Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about NIPT during pregnancy. What is NIPT? It refers to non-invasive prenatal testing, which is a screening test. The test examines a pregnant woman's blood to assess the risk of certain chromosome problems in a fetus. The NIPT test is also called cell-free DNA screening or non-invasive prenatal screening. Fragments of fetal DNA circulate in a pregnant woman's blood. Blood is drawn, tested, then used to evaluate the risk of chromosomal disorders, including Down syndrome, Edwards syndrome, Patau syndrome, and disorders affecting sex chromosomes. Results are usually available within a week or two and provide insights into the likelihood a fetus has certain conditions. NIPT is about 99% accurate in detecting Down syndrome. The test is slightly less accurate for detecting Edwards and Patau syndromes. Overall, NIPT tests produce fewer false positives than any other prenatal screenings, like the quad screen test. Results tell your doctor how likely it is a condition exists in a fetus. Screening for sex chromosomes can screen for differences in the usual number of sex chromosomes. It can also predict the sex of the fetus. The most common sex chromosome conditions are Turner syndrome, Klinefelter syndrome, triple X syndrome, and XYY syndrome. A small blood sample is taken usually after the 10th week of pregnancy. Because it only requires a blood sample from you, there is no risk to the baby. The blood sample is sent to a laboratory where fetal DNA is analyzed for specific chromosome abnormalities. NIPT can be performed as early as 10 weeks into a pregnancy, allowing for early examination of a fetus's health. But NIPT testing can be done any time from 10 weeks of pregnancy up until delivery. The test is optional and should be discussed with your doctor so you can understand what results will show and whether it's appropriate for you. Your doctor can provide information to help you make an informed decision about your options. NIPT doesn't test for all chromosomal conditions or birth disorders, and not all NIPT panels evaluate for the same conditions. It's important to talk to your doctor about what conditions your NIPT is screening for. The accuracy of the test varies by the condition it's checking for. Other factors, such as being pregnant with multiples or being obese, can affect results. The American College of Obstetricians and Gynecologists used to recommend NIPT only if you had a high-risk pregnancy. It's now recommended NIPT be offered to all pregnant women, regardless of risk. NIPT doesn't diagnose conditions. It's a screening test and estimates the likelihood of a condition but doesn't provide a definitive diagnosis. If NIPT results indicate a high risk of a problem, diagnostic testing may be recommended. Diagnostic tests give a definitive answer about whether a fetus has a specific condition. Diagnostic tests include amniocentesis. This procedure removes a small amount of amniotic fluid from your uterus and can be performed after 15 weeks of pregnancy. Another diagnostic test is chorionic villus sampling, CVS. This procedure removes cells from the placenta and can be performed between 10 and 13 weeks of pregnancy. Remember, prenatal tests like NIPT are optional. Getting the test is entirely up to you. Talk to your doctor or a genetic counselor about it. Be sure you understand what the test screens for and what the results mean so you and your partner can make an informed decision. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.